All of us know that a woman will have only two breasts. This is common and widely known to all of us. But in certain rare conditions, a woman can have an extra breast. This condition is called polymastia. That means more than the required number. Usually, this occurs in what is known as the milk line. What is meant by milk line is a line drawn from the armpit up to our genitals. So any breast can develop only on that line. But sometimes it can develop in this line other than where the breast should be, namely in the armpit or in the thigh, etc. Technically, this is known as supernumerary condition or accessory breast. If the breast tissue is there fully, then it is called polymastia. That means breast tissue, the dark circle near the nipple known as areola and the nipple is called polymastia. Suppose if there is only the areola, then it is called polythelia. Sometimes the nipple alone may be present without the areola and the breast tissue also. By itself, it will not cause any health condition or a problem, but it is of cosmetic relevance. A woman may have third breast. She finds it difficult to wear her undergarment, namely the bra. It will look ungainly if she is wearing a t-shirt or a tight salwar kameez. Very, very rarely it can indicate a cancerous condition. Very, very rare. Now what happens is, we exactly do not know the cause, but most likely cause is a genetic abnormality. There is a gene called Scaramanga gene. You must have seen the James Bond movie titled Man with the Golden Gun, right? And there the villain's name is Scaramanga. This Scaramanga gene is supposed to be responsible for this additional breast. Normally, when a woman is pregnant and the child is fetus developing in the uterus womb, what happens is the breast tissue is formed in the milk line, as I mentioned earlier. But sometimes the breast tissue will be scattered to other parts of the body. Usually, this scattered breast tissue will be absorbed during the course of development and by the time a child comes out of the mother. But rarely, this disintegration cannot occur and absorption cannot occur. In such a case, what happens is the third breast or extra breast develops. The most common site is in the armpit. Now, by itself, as I mentioned, it is not a health problem, but of a cosmetic problem. However, just like any breast runs the risk of developing a breast cancer, this tissue also can be prone to developing cancer in later life. So this has to be checked, and if necessary, it can be removed. Even otherwise, the woman so desires, this breast can be, extra breast can be surgically removed. Otherwise, there is no need to get worried. The occurrence is rare, hardly 1 in 2 million women.